Volunteered through the A Broader View program in La Ceiba, Honduras, August 6th through August 12th, 2017. I volunteered at the local community hospital and 2 dental clinics while I was here. The local A Broader View coordinator was named Raphael, and Raphael was absolutely excellent. He was extremely accommodating, making sure we were very well taken care of throughout the entire duration of our stay. He set us up with dentists, doctors, medical students, dental students, and programs throughout the area so that we could do volunteer work, assisting in the clinics, doing procedures in the clinics, performing and actually teaching. So I had the ability to teach several of the people here how to do procedures, and it was just fantastic. They took us everywhere. You know, we didn't have to worry about things. There was always transportation. We took taxis, very safe. They took us to great restaurants, and we had some fantastic food. Probably the best local food at one of these restaurants that I've, obviously, and maybe in all of Honduras. It was so excellent. So he made sure that in the mornings we had all of our breakfast, lunches, and dinners. They were all here and prepared for us. We would go to the clinics in the morning, come back for lunch. Food was ready. We would eat it, and then we'd go back to the clinics or the hospital and do work and come back. So it was very nice. Sometimes we'd take a night off. Carson, my son, and I'm here with my son. We'd take a night off and go have dinner somewhere with one of the students or one of the dentists or the doctors. And that was fine. Everybody was fine with that. And wherever we went, he escorted us to the place we were going so that we didn't have to worry about anything. And there was never a time where I didn't feel safe. It was always very, very nice and secure. So I'd say the most surprising thing I experienced here at the program in La Ceiba was the complete and total lack of operating equipment. Working and functional operating equipment. Things just, they don't have the facilities, they don't have the equipment to perform the procedures at a high level of competence, and that's unfortunate, and so they need equipment. The accommodation, if you're used to living in the United States standards, it's a slight adjustment, but it's absolutely nothing that you can't get adjusted to or live comfortably with once you've gotten used to it. So I would say tips for future volunteers. Well, if you're a doctor, obviously, it's really hot. You might think that you can wear shorts and stuff, but obviously, we all know you can't wear shorts to a hospital. You have to wear pants. So bring a couple sets of pants if you're in your doctor's coat, or just multiple sets of scrubs, which are fine. Medical supplies. If you can bring any medical supplies, anything you have, anything you can get, bring it. Gauze, tongue depressors, toothpaste, toothbrushes, and if you have access and the ability to bring other equipment, like they need an ultrasonic scaler and root planer for dental, they need complete new instrumentation for extractions, everything. They need anything you can imagine, sutures, hemostatic agent, anything you can bring. It will help. Gloves, bring a lot. And so bring as much of that as you can, because it's going to make your job easier too. It'll help you function in a much better capacity. Let's see. The weather here was very hot, obviously. But then again, don't worry about that. The fan that we had in our room blows very nicely and very well, and it keeps you nice and cool throughout the evening so you can sleep. I would have to say we were very worried before coming about mosquitoes. I did not see one mosquito in La Ceiba at all since we've been here. I did not get bit one time. Now, we did go to Roatan before we came, and yes, we got picked apart a little bit over there. And we also went up into the mountains. They took us into the mountains, up the river there, which is beautiful, beautiful area. And we saw some mosquitoes there, but we put on some repellent. That was no problem. Since you're donating in your equipment and supplies, because hopefully when you watch this you'll bring a lot of equipment and supplies with you, that means you're going to have a lot of space in your luggage to take some really cool and awesome souvenirs home with you. So we took a lot of coffee. I have 13 employees, so I took just a ton, and they all drink coffee. So I took a bunch of coffee with me back, and I had plenty of room because I brought a lot of equipment with me, and not enough. You know, I brought a lot, and it wasn't enough. I'm going to be bringing more next time, and there will be a next time. So I would have to say everyone in the program, from Raphael, the coordinator, all the way down to the patients, are very, very willing to help you. And if you can't speak Spanish, they will help you along. They can speak English, and they can help you, and they'll actually help teach you some of the language, which is very nice. But everybody's appreciative, supportive, and very helpful, and they are all right there in helping with the cause to take care of people here, which is it's great. Overall, you know, volunteering to provide medical and dental care here in La Ceiba, Honduras, it was one of the most memorable and rewarding experiences of my life, because the people here really, really need the care, and they don't get top-notch care here unless people bring and donate things and bring the equipment so that can be done. And so it was rewarding to do that. They're very, very appreciative. Everybody, even the kids, after you pull their teeth, you know, they fight you tooth and nail. Afterwards, they'll you know, give you a hug or something like that. Everybody's very, very happy. Some of the people brought us presents and gave us, you know, coffee and necklaces and things. One guy gave me a little keychain with a carved cow horn. It's really neat. It's just very, very, very neat. I was able to teach some procedures that I've been taught in my residency to some of the general dentists here in the clinic, so that they can do TMJ procedures, arthrocentesis, some bone reduction procedures inside the mouth for tori removals, so that patients can wear a denture without pain. I showed them how to reposition and stabilize some teeth, so that if someone had trauma to the face, teeth were busted out but still in their sockets, we just pushed them back and bonded it it looks like a brace across them, and he's going to be fine. Those teeth will survive. So we got to teach those procedures, and at the same time, they were able to assist and teach my son in how to give injections and even do some extractions under very close supervision. So I would describe the accommodations, meals, and security. So this way, I would say in the United States, we're used to a completely different way of living our day-to-day lives. Everything is in good repair in the United States, and if it isn't, people complain, and then they go to the local government. The local government puts money like the streets, and they'll repave the streets. Once enough pressure is put on them, they do that. Here, that's not the way it works. And in the United States, everything seems comfortable and very, very easy, you know, for us. So you know, in most other parts of the world, that may not always be the case. So if you're from like Canada, or if you're from the United States, or maybe Mexico or Europe, it's different, you know. And so you have to understand that. Once you understand that, the accommodations are absolutely fantastic. They're fine. Once you get used to living this way, there's nothing to it. I would have to say that the security was excellent. There's a locking gate-like enclosure in the front of this house, and it is safe. When that thing closes, you're safe. No one's getting in this thing. They take really good care of you. They make sure you're going to stay safe. They tell you, you know, like in any city, you can't go into certain areas of any city, and that's the same here. And they tell you where not to go, and you don't go there, and it's no problem. Meals were fantastic. They're typical local cuisine cooked here in the home, and they're really good, really good. You're going to like that. And the security, like I said, is excellent. I think maybe the strong point, because they're very careful to make sure that you're, you know, safe and secure. The country, my favorite memory of the trip, I think, was probably teaching the dentists here in the clinic how to do a temporomandibular joint procedure. It's called an arthrocentesis for a acute capsulitis of the joint, and that was really neat. The patient could not open his mouth very far without significant pain. It was his right TMJ. So we did the arthrocentesis procedure, and immediately he had great relief, and he'll have better relief as time goes on. So that was really neat. There, he was very appreciative. His wife, she bought Cokes for everybody, and it was great. The country, let's talk about that. It's just beautiful here, you know, and all the people are too. They're very, very sincere, hardworking, caring people, and they just need, you know, a little bit of help in getting them the things they need to take care of themselves. And but overall, the country's beautiful. If you can get up into the mountains and down to the beach, it's great. The mountains up there by the river it's stunning. The ABV support, or I'm sorry, a broader view support prior to traveling. I can't say very much about that. I wasn't the one that set this up. I had my son. He's 17 years old, Carson. So I would be happy and willing to speak with anybody who wants to volunteer to do this program through A Broader View. Let's see. How did we find out A Broader View? Okay. The way we found out about A Broader View, a colleague of mine that I trained with in oral surgery in my training in Houston, I did my oral surgery residency in Houston, has a son who wants to take over his practice someday, like my son wants to take over my practice someday. So they communicate back and forth, and his son told my son about this program down in La Ceiba, Honduras, as well as they have them in other areas of the world. But my son, the time that I had off coincided with this week that we were here. So that's how we did it. Carson found out about it. I told him he had to do all the research to figure out how to do it, and I would go. He just had to handle all the accommodations, which he did. But that's how we found out about it, and hopefully more people will find out about this, because it's the most amazing and fantastic experience you will ever have doing something. You're really doing God's work for people, and they're very appreciative, and they really need your help and donations as well.